Hello and welcome to Diabetes Destroyer Talks. I'm Dr. Lily Kiswani. I'm a gynecologist now practicing integrative medicine. So, what is integrative medicine? This is a recent advance in allopathy where we go to the root cause of illness and we eradicate chronic illness. And that means that you become drug free and healthy again. You don't need drugs anymore because you are healthy again. And that makes you free of stress, free of the risk of complications, free of the worry that you're going to be ill all the time. Let's compare modern medicine to integrative medicine. So modern medicine teaches us a pharmaceutical approach to illness, that you see illness, let's say you see a fever. So you give some paracetamol to reduce the fever. Or you see that there's infection, so you give an antibiotic to deal with the infection. This kind of approach is a symptom suppressing approach. It is, if we take an example of say an overflowing sink, you have water flowing into a sink, the tap is damaged and the water keeps flowing. You can't turn off the tap. So the water overflows from the sink onto the floor. So what do? You get a mop and you try to dry the floor. But the overflow is too much. You can't control it with that one mop. So you call maybe your spouse to help you to mop. The two of you together start mopping. But still there's a little bit more than you can control. So then you call maybe a child or a neighbor or somebody, and say 3 or 4 of you together are able to now keep the floor dry because all of you are vigorously mopping. Now what happens is that the floor is dry, but the overflow is continuing because you're not able to turn off the tap. And also, even though the floor is dry, this continuous moisture could have loosened the walls, the tiles on the floor or on the walls. It could have caused mold to develop on the walls. So what this means is that complications can occur even when things appear to be normal. The floor appears to be dry, but complications still occur. And this is exactly what happens in our body as well. Let's say you're diagnosed with diabetes and you're given one medicine, one pharmaceutical preparation. But it brings down the sugar for a while, but then it rises up again. So then you have a second drug added. Again, the same thing happens. It's controlled for a while and then it goes up again. You have a third drug added, and then you have a fourth drug added, and then you have insulin added. And yet the blood sugars don't get controlled. Why does this happen? Because the root cause has not been addressed. And if we take a tap analogy, if we are able to turn off the tap, then the overflow subsides, and then we can take time to find out the root cause of the leakage. Maybe the valve has been damaged, so we can replace the valve and stop the overflow forever, or at least until such thing happens again. Similarly, if we go to the root cause of an illness, here let's say we're taking diabetes, then the root cause we know is maybe it's insulin resistance, maybe it's toxicity, maybe it's hormonal imbalance, maybe it's stress. So once you are able to control these, we're able to go to the root cause, then you're no longer prone to developing those complications, prone to developing the high blood sugars. Therefore, you don't need the medicines, you don't need the insulin injections, because the body is now able to heal and recover. And you can actually get rid of any chronic illness. Although I was talking of diabetes, but it could be any chronic illness. It could be PCOD, it could be thyroid, it could be just obesity, or it could be an autoimmune condition such as psoriasis or type 1 diabetes. Now, the pharmaceutical preparations that we take in any condition, let's say it's an infection or it's a chronic illness, they themselves have complications. They themselves cause complications. So we know, we've done trials, we know drug A causes these complications, drug B causes these complications, and drug C causes a different set of complications. But there has never been a trial to study what happens when drug A and B are given together. What are the complications that they cause? When B and C are given together, what happens? When A and C are given together, what happens? And certainly not when A, B and C are given together. And most certainly not when A, B and C are given together to a particular person, because our biology is individual. It is not a standard blanket thing that happens to everybody. Although we prescribe paracetamol, take 3 times a day, but our body doesn't work that way. I am different from my neighbor or from my sister or from my father. We're all different. So we need precise treatment which is suited to our biology, to our situation. Let me share with you a couple of examples where I can compare the modern medical approach with the integrative medical approach. So, like I said, I'm a gynecologist, and part of my job, of course, was to treat PCOD. And you know that in PCOD we give hormones which will artificially regulate the cycle, and so you think that you have achieved control. And now, when I started practicing integrative medicine, my very first PCOD patient was a 25-year-old girl. Let's call her Ankita. She said she had a lot of facial hair, and she said this has been there ever since puberty. Since puberty, there has never been a time when she didn't have facial hair. So I gave her all my recommendations, and the hair cycle is a 6-month cycle. So for the follicle to not sprout a new hair would take 6 months. And that is why I did not give her an early appointment. I asked her to come after 6 months. But she was going to travel abroad for work, so she came to me after 3 weeks. And when she came, her face was clean, which I did not consider remarkable, of course, because she might have used some creams or laser or whatever. But no, she had not used anything. And for the first time since puberty, she had a clear skin. So in 3 weeks, what I thought would take 6 months happened within 3 weeks. And as a gynecologist, I had never seen such results. So it was a huge shock for me that our body has such immense healing powers. And why are we not harnessing that? Why are we not showing our body the right path? By removing the toxins from it, by balancing the hormones, by giving it the right nutrition that it needs, by giving it the targeted supplementation that it needs, by dealing with the stress that is affecting us. If doing these things can bring the body back into balance, into health, why should we not do that? Why should we choose the pharmaceutical approach which doesn't work anyway? Now, another example. This gentleman was 67 years old. He was diabetic. He had been taking insulin for the last 30 years. And of course, he was developing complications. He was having tingling numbness, neuropathy, and he was having repeated skin infections and so on. Prescribed my treatment. His son was very diligent. He made sure that his father followed all the advice. Within 48 hours, he was able to give up his insulin. Within 7 days, he was able to give up all his anti-diabetic medication. And 2 years later, he was completely fine. No drugs, no injections, nothing. Just a regulated lifestyle. That's all. He was doing completely well. And this was a result that was unheard of while I was practicing modern medicine. And that is the reason why I chose to switch over from the practice of modern medicine, which of course it's not 100% because there are times when you do require maybe an antibiotic or maybe an analgesic. But now I treat patients using the integrative medicine approach, which is also called functional medicine or root cause medicine or precision medicine. It's all the same. It's harnessing the body's own abilities to heal. Thank you for watching.